Nirvana for her excellent and distinguished presentation. It's a pleasure to welcome and introduce Dr. MIRIAM MIKHAIL. Dr. MIRIAM is originally an Egyptian and a radiologist in IAEA. She has devoted her career to global public health since 2013 as a member of RAD8 International Leadership Team and was previously based at the WHO. Currently, Dr. MIRIAM is the UN lead of the Rapid Diagnosis Working Group of the WHO Global Breast Cancer Initiative and is engaged in IAEA radiology improvement projects in over 30 countries. Please, Dr. MIRIAM.
Thank you so much for the kind introduction. Pathway towards improved radiology services in Africa. Ahlan wa sahlan. So who are we? The IAEA. We're an intergovernmental agency in the United Nations family. Radiation applications for all peaceful purposes. 25% roughly of our IAEA budget goes towards human health. We use a holistic and systematic approach, responding to countries' requests and informed by data. We conduct needs assessment and use matrices. What is needed? What is available and adequate to meet the epidemiologic needs defined? What's not available or needs improvement? How can deficiencies be remedied? And we help support all of the multidisciplinary professionals in medical imaging, both radiology and nuclear medicine. We have many databases for all of what we call radiation medicine, radiation therapy, nuclear medicine, and more recently, radiology. A few years ago, we launched the Imagine database, IAEA Medical Imaging and Nuclear Medicine Global Resources Database, and we're able to show, for example, if you see the bottom left of the screen, that in high-income countries, roughly 25,000 people are served by one CT scanner, as opposed to approximately 1.7 million inhabitants served by one CT in low-income countries. And if you Google IAEA Imagine and hover your cursor over the countries, you'll see the ranges of data for multiple imaging modalities. We have many mechanisms to support the improvement or establishment of radiology in countries, one of which is conferences. This was our cardiovascular imaging conference this past December, held at our headquarters in Vienna, with roughly a few hundred people on site and a few thousand online. Another mechanism in our power to convene a neutral educational platform without national bias, many virtual conferences such as this taking place very soon for nuclear cardiology. We can do similar things for radiology. Dr. Dina Husseini is involved in developing an educational module for breast imaging, and if you access our IAEA Human Health Campus, you'll see many more modules. Another mechanism, multinational coordinated research projects. For example, this one for implementation research of early detection of breast cancer. And if you see at the bottom, one of the many participating countries was Egypt, and this particular project lasted 7 years. For quality, we have our audit mechanisms. And if you see the publication at the right of the screen, free access, comprehensive clinical audits of diagnostic radiology, our quadrille program. But as I mentioned, we have a more established history with radiation therapy and nuclear medicine as an agency and are expanding our outreach in radiology. This is a document, a strategy for enhancing the sustainability of nuclear medicine in Africa. We need something similar for radiology. And once again, Dr. Gina Husseini is very much involved in the African Regional Cooperative Agreement. Many publications, both peer-reviewed journals and books, for example, this one developed by the WHO and IAEA, a framework for developing cancer management in countries. And we recently launched our Rays of Hope initiative, and we help a lot of countries, including here in Africa, with development of national cancer control plans. Radiology, believe it or not, was previously absent from these plans, so we're writing it into those plans. We're engaged in many UN interagency initiatives. I have the privilege of being the UN lead for the Global Breast Cancer Initiative's working group on rapid diagnostics. We're engaged in many technical cooperation projects, and in both nuclear medicine and radiology collectively. From 2012 through 2021, we conducted over 200 training courses with nearly 5,000 participants now. We sent trainees to over 1,500 fellowships, many expert missions where we brought experts into countries to teach. We also conduct many procurements of equipment, technology transfer. There exists great potential for IAEA expansion of medical imaging, analogous to the history for radiation therapy. For example, here you have Ghana, and we actually mapped out where radiation therapy existed, only in the south, and as a result of realizing that the catchment area was not adequate to enable radiation therapy to many patients in the north, we planned radiation therapy in the north. We're just starting to do such geospatial analysis for radiology. Imaging, as you know, is cross-cutting for epidemiologic priorities in Africa. If you look at the most common causes of morbidity and mortality, for example, cardiovascular etiologies, pediatric pneumonia, fetal perinatal morbidity and mortality, car accidents, road traffic injuries, tuberculosis, breast cancer, and our Rays of Hope initiative, launched here in Africa, actually at an African Union summit, aims to enable both the multimodality imaging requisite to cancer management and radiation therapy. And here you see the first wave of countries being supported extensively, all here in Africa. But we use creative approaches too. For example, the IAEA has this ship supporting breast cancer screening to reach the hard to reach along the Amazon River. In conclusion, it's a privilege to continue such dialogues. This is a meeting just a few weeks ago in Vienna with the ISR leadership, International Society of Radiology, and ESR leadership, European Society of Radiology. This took place just before the European Congress of Radiology, and we're very grateful for the continuity of such constructive dialogues. There is no one-size-fits-all approach. As Dr. Goifel mentioned, we are here to learn from you, the member states, to respond to your requests and tailor our support in radiology to those requests sustainably and in the most appropriate, beneficial way. So how can we best help strengthen your radiology services to meet your population-based needs? Together empower, and grow. So the IAEA looks very forward to partnering with you in more medical imaging initiatives. Shukran gazilan, and I hope you can visit us in Vienna. Thank you very much.
Shukran, Kurumari. Thank you very much for her excellent talk and for her continuous support for all countries, especially Africa and